The thin line between duty and what for the health workers has been the cause of fighting for the greater good for 11 days now. One that for these health workers at the Coast General Hospital overrides the most important duty to them, Sunday afternoon, saving a baby who was found badly mauled by a dog. This after she was dumped in a bush in Rabai Kaloleni, her family having since abandoned her, an eventuality that sees the health workers at the hospital struggle to save her life.
Alikuwa amemuuma mdomo, mkono wa kulia amekata, lakini mtoto angali alikuwa hai.
And in attending to the baby, the health workers giving the strongest indicator yet that the strike could be coming to an end.
Mtu yoyote mwenye ako na mimba na naona hataweza kutuza huyo mtoto, afadhali aje azalie hospitali, apeane ati akizaa huyo mtoto hamtaki, ili huyo mtoto aweze kuwekwa mahali pema.
Yet it is a state of empty beds at the Rift Valley Provincial General Hospital, the biggest and busiest hospital in Nakuru, that puts into perspective the gravity of a situation in the past week that has continued to see patients question whether the strike is on or off. The position of the Kenya Union of Civil Servants is one that they hope will see the medical fraternity return to work as the union officials hold further talks with the government regarding the workers' grievances.
Officially, the strike is off, and we expect our members to resume duty.
So a few hours before the Monday return to work deadline, and we seek to find out, does the directive to sack health workers who do not report to work Monday still stand?
They have started going back to work. It would be painful to carry out the directive, but we're just encouraging the nurses to go back to work. Those who don't, of course, we have no other alternative, because we need services in our hospitals.
What contingency plans does the government have in place should some of the health workers not report to work tomorrow?
Directives had already been given to all provincial medical directors, provincial directors of medical services, telling them to recruit retired workers, unemployed workers in the health professions.
According to a public notice in the Sunday papers by the Ministry of Medical Services dated Friday 9th March 2012, if the striking health workers resume duty, they are entitled to the payment of extraneous allowances. The notice stipulating a formula that would see health workers paid in two phases, the first phase having been implemented in January and the second due to be done in July, with the government now saying that it has harmonized all the salaries of health workers across different job groups. Doctors, dentists and pharmacists will be paid between 15,000 and 20,000 Kenya shillings as extraneous allowances, while clinical officers and nurses will be paid between 7,500 and 12,500 Kenya shillings.
And I'm determined, and I've said so, that we shall improve both the infrastructure and the conditions of work and emoluments of workers. But there is a limit to it, because, you know, now we have a Salaries and Remuneration Commission, and no government ministry can go past that.
That said, the jury is still out on whether the health workers will return to their workstations or not come Monday. Mbilu, Sunday Live.